Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, we're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.
Welcome to another episode about clear answers, about clear vision. I'm joined today with a few of my colleagues here at Vance Thompson Vision. We have Matt Walker, who is an optometrist up in Alexandria up north, where the snow has just melted. We have Cullen Ryburn. He is a cornea surgeon and cataract refractive surgeon out in Loveland, Colorado. And we have Lori Preventure, who is a cataract and glaucoma surgeon down in Omaha. Thanks for joining us, guys. And today we are talking about the number one performed surgery in America every year, probably the number one surgery performed in the world, and that is cataract surgery. There's anywhere from 4 to 5 million cataract surgeries done per year. Here at Vance Thompson Vision, we do about 1 out of every 200 of those cataracts. So we know a thing or two about cataracts, and we want to answer some questions. So Matt, why don't you kick us off and talk to us about, I'm in your chair and I have a cataract. Give me the lowdown, the 2-minute version. Tell me what a cataract is and what we're talking about.
Yeah, happy to do it. Usually, by the time patients are seeing us, it has already been determined by their primary optometrist that it is a cataract, but I'll play that role too as well. Normally, it's happening when the quality of your vision is declining. You go into your optometrist for a new pair of glasses, and they flip the dials 1 and 2, and it's not working anymore. It's not making it any better. You're noticing an issue with decline in your night vision, glare halos, can't drive like I used to. A lot of patients report they struggle with needing more light to be able to read, and just quality of vision's down. So what's happening, it's not a change in glasses, it's a natural lens inside your eye about the size of an M&M. And when you're younger, it's crystal clear. As you add those birthday candles, it starts to get yellow, hazy, cloudy, and will start to affect your vision. And when you're noticing that change where vision is not when it like it used to be, it's probably time to get it out. So that's a cataract, and everybody gets it, and everybody's going to need surgery eventually.
Yeah, I love it. You know, one thing you were talking, this happens over time, and the lens used to be clear. And Cullen, how did the lens used to help us? You know, when I'm 20 years old, what is my lens like versus when I'm 40 years old versus when I'm 60 years old? Kind of walk me through the life and the day of an aging lens.
Yeah, great. So as Matt mentioned, the first part where the lens is nice and clear, it's also really flexible. So when you're looking far away, it's nice and stretched out. When you're looking up close, it flexes so that you can get that range of vision. So you're getting both that far away and that up close. And then one of the first things people start noticing as they get into their 40s, they say, hey, man, the lens or my vision's just, I can't read up close anymore. Something's wrong. I need to have my glasses changed, and not realizing that that lens has lost some of its flexibility. So then they start having reading glasses, progressives, or bifocals. And then over time, over the next 20, 30 years, it continues to become less and less flexible, less range. There's more of, hey, this is the one spot where I see the best. Anything further than that, it's blurry. Anything closer than that, also blurry.
Love it. I love it. Yeah. So, you know, this is the lens starts to change, you know, in our 30s, and we start noticing it probably in our 40s, but some people earlier or later, and we start holding things further away, and then our arm's not long enough. I don't do good arm surgery, so we do lens replacement surgery. Lori, when is the right time to get a cataract out?
Yeah, I love that question.
One thing I constantly hear, or not constantly, but a lot of people come in and say, is it ripe enough or is it too early to take it out? So when's the right time?
Yeah, I think this is something that's evolved. So it may be different from what your parents or grandparents had told to them versus what we're doing now. I tell patients that cataract surgery has gotten so safe and so minimally disruptive to the quality of life of a patient to go through the postoperative period, and we'll talk about that, that we're doing cataract surgery earlier and earlier so the patients can have optimized vision for longer in their adult life. So generally what I tell patients is we look at two things. We look for symptoms, like visual symptoms that warrant the risk of surgery, which is overall very small. And like Matt talked about, it's something that we can't correct with glasses anymore. So you're kind of past that threshold. And then also insurance has certain criteria they look at as well. And that's what part of your evaluation is for, is to make sure we can get insurance coverage for cataract surgery. So those are the two things, but also even more recently, folks are having cataract surgery before they even get any sort of opacity or blur to their lens. It's when they're in that phase that Colin talked about, where that lens is losing its function. So it's not functioning as well to flex and give us that near vision. So surgery's become so safe that we're doing what's called a refractive lens exchange. And that's not exactly the topic of this podcast. We will have one on it, but it's so safe to do surgery that folks are electing to do it as soon as they start to lose that near vision. And that's really exciting and a fun part of our job.
So, timeout. We were talking about how is it too early to do cataract surgery? And you're saying some people don't even wait to have cataracts, they just get their lens out. Why, Lori, would somebody want to do that? Why would you want to get your lens out before you have a cataract?
Right. Like I said, safety is always number one. We want to guard and protect vision and do the right thing. And now that cataract surgery, or lens removal surgery, if you want to think of it that way, has become so safe, we're offering it to patients before they get that opacity so that they can restore their reading range. So, loss of reading range should not be minimized. That's a huge inconvenience and a huge deal for patients to have to be searching for, picking up readers, wearing a bifocal, looking through a progressive that's distorting the vision. And so patients are electing to have that same lens removal or cataract surgery earlier so that we can make their vision better for longer.
Yeah, that's a great point. Something that we get a lot of folks in, and some folks despise glasses, some folks love their glasses. But one thing is, it's not just about glasses, it's also about, like you're saying, that bifocal reading segment. And one thing that's important to understand is that bifocal reading segment can kind of block our lower vision, so it starts to distort the vision of our walking and stuff like that. And we don't think about that vision too much because our brain doesn't bring it to our, we don't have to consciously think about that. Our brain's just kind of working, but that's blurred out sometimes with the bifocal and progressive. And so some people don't tolerate that well. And the thing you were talking about was the lens that goes back into the eye. And so normally when I talk about cataracts, we talk about just what Matt and Cullen and you guys were talking about with the aging lens, and now it's time to get it out, and that's going to help you see clearer. And then I say the next biggest thing you decide after you decide to have cataract surgery is which lens goes back into the eye. Matt, walk me through that conversation. What does that look like? What options are out there these days? Go.
My conversation has evolved. I've gotten less bad at it over the years. No, I've gotten better at it, where I used to dive into all the different lens technologies. This is what it'll do. This is what it don't. You got that, right? Okay, which one do you want? Okay, wait, go over that again. Patients that come see us, like they're just getting their head wrapped around that I have to have surgery in my eye because I'm not seeing well. To me, an amazing time to have cataract surgery because of the lens technology that's out there. We now have, probably what, 7, 8 lenses that we're using in different individuals depending on their goals. But and some of them come in really prepared, saying, "Hey, I did my research. I want lens A." Others are like, "Look, my doc said just, come, let's go." I break this down into goals with vision in 3 different roads. Road number 1, you're in glasses now. You'll continue to wear glasses now. You'll have better vision, but you will wear glasses for distance, dashboard, and near, and you'll be in glasses but see very well. Row number two is we can correct with the implant technology your clear distance vision, so you will not require glasses anymore. Or those that aren't in glasses, we can keep you out of glasses for distance, but you would have to wear cheaters for fine print. For some, that's old hat where they're used to it. It's usually an easier transition. For those that have not done it before, cheaters on and off is a big deal. So like Dr. Laurie had mentioned, it's the loss of near vision is not, is a real issue. Then we have some that are like, hey, I want to go for it all. What's the best? Well, again, I think they're all best depending on goals, but some are like, I hate glasses to begin with. I'd rather not wear them at all. You got that option? Well, kind of, yeah. And we have lens technology where you'd wear nothing for distance, nothing for arm's length dashboard, and usually almost nothing for up close.
Yeah, great talk. I love how you break it down into 3 different categories, and to kind of review those. One would be to try and put a lens back in that is similar to the lens we had when we were 20 years old. It gives you good distance vision, but it also restores that range of vision. And so I say those lenses do 3 things. One, it's a clear lens. All of the lenses are clear. And so all of them are better than your cloudy cataract. 2, it fixes astigmatism. And that's the shape of the cornea. And so we leave that alone, but we put in a lens that fixes that astigmatism to give you clear distance vision. And then 3, it's a trifocal, meaning that it gives you good distance dashboard reading. Now, I never say, hey, you're never going to be in glasses for anything forever and ever. I usually say, hey, most people are out of glasses for the vast majority of things, 98, 99%. You might find that one thing that you like to throw on a pair of cheaters for. Or boy, when it's 9 o'clock at night and it's a blizzard, you might have a pair of driving glasses that you like just to crispen things up a little bit. But our goal is to get you the least dependent as possible, or at least the least amount that technology allows us these days. So that was that trifocal option. 2, that to fix the astigmatism and give that great distance vision. And then 3, the basic lens, or the monofocal lens that doesn't fix astigmatism and doesn't have a range to it. And again, it's a great lens because it's better than a cloudy cataract. It's just a lens that leaves you in a bifocal or trifocal pair of glasses. Now, so we have the lens talk. The one thing that I say, or one question I get is, Lori brought this up. Hey, people are having surgery earlier and earlier. Cullen, when am I going to have to repeat this? When are my cataracts going to come back? When am I going to have to, is it like an iPhone where I need to switch this lens out every 2 years, or what's the story there?
Yeah, great. So I wanted to add one extra piece in to the lens
Yes.
discussion talk, in that when we'll have some people who say, hey, I've always taken my glasses off to read, and I kind of want to just stay like that. And we can do that too. And to get that best vision, let's say they have a lot of astigmatism in their corneas, but they don't in their glasses. And they're like, I don't have much astigmatism, but we see that they do. And that after surgery, their vision may not be what they were expecting for up close. So sometimes we'll use that astigmatism correction to get them the best reading vision too. So it really is, like you guys were talking about, figuring out what the goals are. Where do you want to have the least dependence on glasses? And again, some people is going to be for reading a book up close, or reading their phone or their tablet. And we can certainly hit that goal as well. In terms of asking like, hey, so is this going to come back? The short answer is no, it doesn't come back. The main cataract doesn't come back. But when I talk to patients, I tell them that the cataract is like that M&M that Matt described earlier, and we kind of peel off the front part of that candy shell, suck out the chocolate and the peanut, and put that clear plastic lens in the remaining shell. Now, sometimes, and depending on how old the patient is, the back part of that candy shell can get a little hazy or frosted, or however you want to describe it, that can feel like the cataract is coming back. Thankfully, we have a really quick procedure. We dilate the eyes. It's a little microscope-based laser. They hear just a couple clicks, click, 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 and that's it. It takes a few seconds. We only have to do it once.
How
So,
painful is that?
one more
How
time.
painful is that laser?
How
You cut out,
painful.
sorry.
I'll pay.
Oh,
Sorry.
not painful, not painful at all. Yeah, not painful at all. Sorry, I couldn't catch it on, must have been a little internet, but not painful at all. It takes just a few seconds. And then by the next day, when the dilation's worn off, pe most people are seeing better. Sometimes, let's say you had glasses before, sometimes it can change the prescription a little bit. And so you might need to go back to your regular eye doc and get those prescriptions updated. But thankfully, it's quick and easy. We tell people on average about 30% of people are going to need to have that. The younger you are, the higher it is. So kids who have to have cataract surgery for whatever reason, we say it's 100%. So everyone's a little bit different.
Lori, we talked about, these lens options. And so great point, Cullen, that cataract doesn't come back. We don't swap these lenses out. It's not an iPhone or a car. It's not going to get old. I usually tell folks it's plastic, so it lasts around a couple thousand years. And if you want to, you can come, we'll swap it out for free at that point. But this is a big decision. It's the rest of your life with this lens. Lori, there's some cool technology I think that you guys are using down in Omaha to help people because we're talking about it and there's only so much words can do. How are you guys educating your patients down there and at a few other of our VTV sites?
Yeah, we have really exciting technology where it's a virtual reality simulator that the patient can put on. So they see the technician, get some preliminary testing done. They may even get their eyes dilated. And then before they meet with a doctor, they put on this little lightweight headset and can go through these different scenarios, like a daytime scenario where you're in an apartment. You can play around with reading, seeing at distance. And then a nighttime driving scenario, which is a really important thing to discuss with patients, is what their night vision will be like. And so they can go through that environment as well. And what the technician does with the patient is using their specific measurements for their eyes, plugs that in, and then can simulate what it would be like to try these kind of 3 different main pathways that Dr. Matt talked about. So it's not perfect. It's the best we have out there. And a lot of patients, if you put them through the simulator and then afterwards poll them, hey, was it accurate what you saw? The overwhelming majority says yes. So it's a good reflection of what life will be like after you make this humongous decision. But it's been great. It's a game changer, I think, because like Colin and we've all talked about, it can be really hard for patients to understand what maybe loss of that natural near vision is like, or giving up the distance for the near or vice versa. And so getting a little teaser is really nice. And then it streamlines the conversation with the doctor. So you can see it, envision it, and then go over it with the doctor. And then the doctor can match the best technology to help you achieve that goal you want.
Yeah, I love that education piece. I love educating cataract surgery, cornea surgery, glaucoma, whatever it is, getting people to understand what's going on with their eyes and how to use their vision more. And man, but so as much as I do this multiple times every day, year in and year out, there's just some times where, I'm 10 or 15 minutes into talking about stuff and I just feel like we're getting wrapped around the axle. I can tell we're not connecting and I'm having a hard time explaining what vision's going to be like after cataract surgery with these lens options. And I just say, hey, I've got a VR headset. Do you just want to? And it's kind of like the ultimate 1 versus 2. And you get to kind of try these on and, see the pros and cons for yourself, which is great. Well, lovely. We talked about lens options. We talked about patient education. Cullen, just how safe is cataract surgery? We're talking about how we're standing on the shoulders of giants with technology and stuff. Maybe we're even doing lens replacement surgery before people have cataract surgery. How safe is this? What kind of risks are there? All of that good stuff.
Yeah, overall, cataract surgery has gotten very safe, as Lori had mentioned earlier. And, as any surgery, every surgery is going to have risks. And I tell people kind of 3 main things. The main risks of having cataract surgery: 1, chance of infection; 2, chance of needing another surgery or procedure; 3, the biggest, scariest one, the chance of losing vision we can't get back with glasses or contacts. Now, they're all extraordinarily rare. And we have all kinds of advancements in the technology that we're using, the lenses that are going in, the size of the cut that we need to do the surgery is getting smaller and smaller. The speed of the surgery is getting more efficient. And overall, it's just in general a safer procedure than it used to be. One of the biggest inventions or discoveries we've had recently has been that if you put some antibiotics in the eye at the end of surgery, that we can really cut down the risk of infection. And so having good preoperative cleaning and antisepsis, as well as then putting in some antibiotics at the end of surgery, overall, the risk have gotten so low that it's become a really safe surgery.
Yeah, and to put like numbers to that, it's somewhere between 1 in 10 to 50,000 with antibiotics in the eye. Um, Infections after surgeries are horrible regardless of the surgery, and so we're very belt and suspenders with that, with in regards to antibiotics in the eye, antibiotic drops after the eye, betadine before and after all of that stuff, and we don't see a lot of infections, much less than one a year per surgeon, and so and we're doing lots and lots of surgery. So ultimately, one of the most common surgeries and one of the most safest surgeries done in America, not just in eye care, but in America. Walker, walk me through what patients should expect on the day of surgery. So they have an evaluation, and some people think that we're just going to take their cataract out in clinic with a laser or something, but it's different, right? You're having your knee replaced, you go see the knee surgeon in clinic, and then you have to go to the surgery center for surgery. So we've had our evaluation. Now it's surgery day. I'm showing up to the surgery center. What's that process look like?
Well, I might argue in Alexandria with our See and Do program, it can be an option where you get your eval that day and then you walk about 10 steps next door to our surgery center in the same building. And man, if you're ready, we're ready. Let's do it. And some cases really fun, especially here in rural Minnesota where patients have to travel. What's nice with this surgery is that there's typically no or minimal blood involved, so you can take all your medications the night before. We typically have you stop eating or drinking before midnight. You get there that day, and you got a driver with you because of the good drugs that we give you to make you super comfortable after surgery. Check in. They give you anesthesia, which some patients get really nervous about because it makes them sick and it makes them kind of feel different. And the most painful part of the cataract surgery that we got in some prior surveys was the IV stick for that anesthesia, where patients hate needles in general, or they just don't like that sensation. And now instead of doing IV, we use a melt under your tongue called MKO melt that gives you the similar anesthesia to a colonoscopy, where you are kind of in and out, conscious sedation, you're comfortable, relaxed. But then it also has an anti-nausea medication in it that a lot of patients get worried afterwards if they get nauseous. Usually the risk of that is really low. So they get checked in. Usually they'll meet Dr. Risfit that day, or Dr. Kramer, sorry, that day to say, hey, yep, this is me. I confirm Matt's plan. This is what we're doing, right? Any questions? And then we get that process of the melt started and get you in for surgery.
Great, Cullen. So, recapping that, patients come in, they're sedated. We don't put a breathing tube in, you don't go fully asleep, you're awake. That's kind of scary for eye surgery. And I say, look, this is about a 5-minute surgery, 5 to 10 minutes, not painful at all. It's mostly just a 5 to 10 minute light show. And the medications we give you, whether it's under the tongue or through an IV, make it a pretty extraordinary experience. Not painful though. And you're going home the same day. Patient gets back to the operating room. Walk me through cataract surgery. What's going on from when we sit down to do surgery to when they're, going out to the PACU and going home?
Yeah, it's a great question. So I'll start it from kind of the patient experience, and that you're coming in on a bed that rolls with you and you're nice and relaxed. We help move you to get you into a comfortable position. You got a headrest. Sometimes you got some support underneath the legs to get you nice and comfortable. And overall, your job is just hanging out and staying nice and relaxed. You'll hear some things going on. You'll hear some funny noises from the machines getting set up and the table getting ready and people kind of moving around to get everything all prepared just for you. And then as we're getting ready to get started, you'll have a little bit of a eye cover that'll go on just to help keep things nice and clean. Then you'll notice a bright light that's going to be coming in that, depending on the type of machine that we have, might have one light or three little lights that you look at. And then you just stay nice and relaxed. And then before you know it, you say, "Oh, are you done already?" As the drape's coming off, and then you're rolling back out. So
Which
that's
I will say is generally the most painful part of the surgery is when the drape comes off the face. It's kind of
yeah,
a
yeah, the pre-facial.
so
Yeah, that's exactly right. So
just to put it in context of how painful is cataract surgery, by and large, the majority of people say, "I'm done already," and then we take the drape off and they say, "Ouch, that was the worst part."
yeah, yeah, no, it's 100% true. So from our side, from like the doctor and nurses and circulator and surgical technician side, I mean, there's a lot that's going on that as a patient doesn't really impact you. Your job is just to hang out and stay nice and relaxed. But we're making sure that we're getting everything in order. We do the surgery the same way each time. And by doing it the same way, we get really, really consistent times, consistent outcomes. And from our standpoint, I mean, we're doing tons of these, but from a patient standpoint, that's the only time they're going to go through it in their life. And so even though we do thousands of these, we treat each and every case like it's the only case that we're doing that day. And our focus is 100% on you, the patient, in your specific case. And we've done it so often that we're able to have all these other complicated things going on, but it feels routine. It's like riding a bicycle. And once you get enough practice, then all of your attention is just focused 100% on the person who's in front of you and making sure that you're taking care of them.
Lori, I think we got about 5 minutes left. There's a few big things I want to touch on. Let's keep on going in order. We go home after cataract surgery. What's the healing process like? Am I like wearing patches for the next month? What restrictions are there? What do I expect as I heal up from cataract surgery?
Right. Uh, Overall, extremely easy, like I mentioned earlier. I tell patients generally vision bounces back within a couple days. Now that's going to vary a little bit on what lens implant you choose. Some people have a small delay to getting a new pair of glasses to get their full clarity after cataract surgery, but most cases when we're correcting a lot of the vision with the implant, you're going to have clarity coming back within a couple days. I tell patients you're going to need to just take it easy for a week. So just don't do any huge heavy lifting for a week, just kind of light activity, and then don't go underwater in a pool or a hot tub for 2 weeks. So, those are things that are pretty easy to avoid, and you can do your day-to-day routine without much disruption. Really important not to drive for 24 hours after the anesthetic because you might be a little off balance or not even realize how kind of loopy it makes you. But that's about it. I mean, as far as pain everyone worries about pain. I'd say for pain, it almost feels at the most in most patients like an eyelashes in the eye, a little scratchy where the incision's made. Some patients feel nothing though after surgery. And you might feel an eyelash in one eye and the other eye feels nothing. And so that's normal. The eyes are sisters, not twins. But overall, I think pain is the last thing to fear. And I think that it's become very, very easy on the patient. And sometimes patients say they wish they had a third eye so they could come back and hang out with us again.
Now you said incision. When do you get your stitches out after cataract surgery?
Well, you don't because there are no stitches. So that's another nice thing. Cataract surgery, I probably put a stitch in an eye once a year, unless it's a planned stitch. Sometimes we do that, but the incisions are self-sealing. They're so small. They're 2 millimeters wide roughly. And we can just kind of swell those incisions shut on purpose. And then as that swelling resolves, the incision heals up. But it's also why it's really important, and I didn't mention this, not to rub your eye for that first week. We don't want you popping open that little delicate incision that we make. But yeah, no stitches.
PSA from an eye surgeon, don't rub your eyes ever before, after, definitely after any surgery, but just it's bad for your eyes. Okay, now you heard it. Cullen, we get one eye done. Okay, my right eye's done. And I feel like a lot of places, a week, 2 weeks, maybe a month later, we're getting the second eye done. Walk me through how we do surgery at Vance Thompson Vision. Maybe not always, but a lot of the times, how are we doing? When is the second eye happening?
Yeah, great question. I think to help set the framework for it, why do people space it out two
Yeah.
weeks, a month? And they've just always done it like that, right? So
Dogma. That's how we do
people
it.
have we that's how we do it, and then that's what we do. So um as cataract surgery has gotten safer, as the outcomes have continued to get better, as the recovery times have gotten faster and faster and faster, we've discovered that overall it's really safe to put the eyes really close together. So we're doing most commonly surgeries one day apart. So they'll come in and have the right eye on Wednesday, left eye on Thursday, and that's it. And then the eyes recover together. It's really, really, really great. Now, there are specific circumstances where sometimes I say, hey, I don't think that you're a good fit for one day apart. Maybe you've had some type of eye surgery in the past that may impact how you recover. And I say, I think we should space it out, a couple weeks. Or if the cataracts are really bad, or let's say you live alone and you have a lot of steps in your house, and I'm worried about just getting around, and if you were really cloudy on that one day after surgery. But the vast majority of people were doing one day apart, and it has been a game changer.
I love it. So to recap a few things, highlights I would say about cataract surgery, maybe questions you should ask if you're getting cataract surgery would be, you know, one, how safe is it? Talk to your surgeon, get to know your surgeon. But really, after you decide to have cataract surgery, the next biggest thing you have to decide is which lens goes back into the eye. It's a forever decision. And it's how you're going to use your eyes the rest of your life. And so have a conversation with your doctor or surgeon about that. Um, Two, cataract surgery is really safe. It's a safe surgery, so safe at VTV. Most of the time, we're doing them on back-to-back days. I usually tell folks, we don't do them on the same day most of the time. Most of the time, we like to see that first eye heal up overnight and make sure things are looking good the next day. Then we'll get the second eye done the next day. But people love that because then they can kind of heal up all at once and get back to life. Um, some other cool things in addition to some of the cool education stuff like the VR headset Lori was talking about is um, our see and do program where we can work with your optometrist to see you and have a clinic evaluation and then turn around and do your first surgery that next day or that same day and next day. And so it's kind of a one and done experience where you're coming in on a Monday and you have an evaluation Monday morning, surgery Monday afternoon, second surgery Tuesday, and that's about it. And one thing we didn't touch on a lot, but we're running out of time, is a lot of your follow-up can either be with us, we'd love to see you, or it can be with your local optometrist, because those follow-ups are usually quick and easy. And so if it's more convenient for you, a lot of the times we're working with your local optometrist just so you're not driving an hour back to see us for a 2-minute visit for us to tell you everything looks great. And so that's kind of the whole process with cataract surgery. I think we hit the highlights. If there's not anything big you guys want to add, I do want to close on one question. Matt, if you were to have cataract surgery or your mom were to have cataract surgery, which lens would you choose? Which one and why, or which category of lens would you choose and why? And we're going to go down the line.
And before we jump into that, I think we should get to that, but let's talk about, hey, what do I have to do after surgery from a drop standpoint?
Oh, yes.
My
Good point.
parents had 10 bottles that they had to keep track of. And so maybe Matt, what if you walked us through like your conversation with the patient about what kind of drops do I need after surgery?
Yeah, most patients aren't real big fans of drops. In fact, so we try to keep it to a minimum. We combine all three of the medications that are needed post-operatively into one bottle. So instead of taking 12 drops a day, we're at, one drop 3 times a day in each eye. We give you this nice little checkbox schedule that even if you're a little blurry after surgery, you can still usually see. So less is more on the medication because we're able to use some in the eye. We use it topically so we can reduce that. One little quick mention as well, you might hear elsewhere, hey, we're doing dropless cataract surgery. We're all aware of it. My grandma had it done back about 15 years ago. In Alexandria, we're kind of on the fence about it because you get this breakthrough inflammation. The eyes get red, light sensitive, uncomfortable. So my grandma had that experience where she had to go back on drops, and it was kind of messy and not as nice of a clean postoperative experience. So we like the drop a day where you just have all 3 drugs in one bottle, and it makes for a nice, smoother postoperative experience for everybody.
Yeah, the other way, go ahead, keep going.
No, I was just saying for my implant, I don't know if sorry if you're going to keep talking about drops.
Oh, just briefly, I was going to say sometimes with that dropless cataract surgery, you'll have people who get an injected steroid over the white of the eye, and it'll leave a white spot that takes 3 to 4 months to dissolve. And depending on how that medicine settled in, it can be pretty apparent and sometimes can shoot the pressure up pretty high in the eye, where we have to go back and do a second procedure to remove all that medicine. It's rare, but it can happen, and it doesn't happen when we're just doing 1 drop a day with the combined medicines.
Yeah. Cool.
Yeah, I like it. We love advanced technology. I love the drop a day program where we take all the drops and compound them together, and you're on one single drop. We've tried dropless, and we just find that the experience is a little bit better with just using a drop a day. We're close, but not quite there.
Yeah.
Good point, Cullen. Any other big questions before Matt gets to our big question of the day with lens choice? Go for it.
All right. So you said either me or my mom. My mom had the trifocal lens 3 months ago, so firsthand experience with that, or secondhand. She was actually 2020, and she probably won't want me to share this, but she quit coming to our house for dinner. And she's just like, I can see great during the day, but I can't see at night, and it's not safe. I don't feel comfortable. So we'd either have to go to her house or go pick her up and go to dinner. And so she got the trifocal that, yes, has some glare halos. How much? Not much. Where even 3 days post-op, she came to our house for dinner. And of course, I'm like, well, how was it? And she's like, yeah, there's a little glare ring around the headlight street light, but it's all better already just 3 days after surgery. And she went from wearing glasses since 2nd grade to now she wears nothing. So when it's my turn, if it's still time for that, trifocal all the way. And also one more thing, a lot of patients don't want trifocal because they think that's 3 separate lenses and they have to do this to look around to find that. No. It's a multiple focal implant where you get distance, dashboard, near, kind of all together, and your brain does the implant does the work, so your neck doesn't have to.
Love it. Cullen, what are you going with?
Yeah, great question. So I think for anyone who's like, hey, I want the most extended range of vision right out of the box, that trifocal lens is for sure the best option we have right now. My eyes, I've had PRK, pretty high treatment. And so from my standpoint, a trifocal, I'm not a great candidate for it. So we haven't touched on this lens, but it's a lens that we can actually adjust with light treatments after. It's called the light adjustable lens, and it's a really great lens, and it's what I would pick for myself at this point.
Yeah, my favorite with a light adjustable lens is you're kind of in the driver's seat. You get to decide what you want. You get to really dial it in. And I tell folks, you're going to invest a little bit of time with that. You get to see me a few extra visits where we get to dial that in for you. And so people are, coming back and seeing us a little bit more. Lori, how about you?
Yeah, my mom had a trifocal placed as well a couple years ago, and she loves it. She was in glasses full time, doing a progressive for many years, and now she wears no glasses. Maybe grabs cheaters every now and then for, like reading the ingredients on a pop can or something like that.
Which we do all the time.
Yeah, I'm
Don't do
always
that.
checking, the Diet Coke, got to make sure it's got the nice fake sugar in it that I like. She does report some halos at night, but they don't bother her. So I think it's a real thing, but I don't think it needs to be overblown in the right patient, but you should have that conversation with your surgeon. For me personally, I would pick the trifocal because I love the idea of having both eyes matched up, full range right from the jump. But I also have had laser corrective surgery. And I love the idea of adjustability afterwards. So we wouldn't want to re-laser my corneas. They're pretty thin. So having the ability to use UV light to adjust those implants to give me exactly what I want, and I can, in between adjustments, go do my work on my laptop, see patients, get it just dialed in exactly how I want it before we lock it in. That's probably the way I'd go at this point.
Yeah, and I love it because we've had a few folks who've had LASIK or PRK or a laser surgery to get out of glasses, and that goes into our decision. So this is a very, one-on-one, customized, personal conversation you're having with your surgeon on which lenses, are even on the table, and then which is best for you based on your goals. I am untouched. My corneas haven't had LASIK, so I would probably go with a trifocal when the time comes, probably before I develop cataracts, when I have, I'm reaching for cheaters more and more. Because I've had a good experience with that. And I usually tell folks, this is the last thing, and then we'll probably hop off. But I tell folks we helped with the FDA study, and then we did our own study afterwards, and we sent out surveys at about the 1 year mark. And the reason why 6 months to a year, and the reason why it wasn't right after surgery is because there's a healing phase to this. And you're not laid up at home on the couch for 6 months, but things get better. It's the opposite of a new car. It's you drive it off the lot and things get better day by day, week by week, month by month. And there's a few different phases of healing that you go on. But once you settle in and go through those healing phases, and at that 6 to 12 month mark, you'd take the survey. We found that right around 99%, a little over in each study we did, said that if they go back, they would choose the exact same lens. And that is the take-home question for me. But we did touch on halos at night. And so it's important to talk to your surgeon about what that is. Maybe throw on a VR headset to actually see what they're like. But I do tell folks that, hey, on that same survey, about 2/3 of people still notice those halos at night around lights. And it's kind of like my folks who've had LASIK. My wife had LASIK, and she noticed the halos right away after LASIK. And then I kept on asking her. And then finally I asked her at a year, and she was like, oh, I don't know. I'll have to check it. I'll check tonight and see if I actually notice them or not. And so it's one of those things, our brain kind of neuro adapts to them. And if you look for them, you might find them. But generally, they're there, but not bothersome. All right, guys, that's all we have today. Thanks for talking about cataracts. Matt, Cullen, Lori, always good seeing y'all. And we'll log off. Thanks, everybody.
Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.